can we approach our doctors? We feel something, and 9 times out of 10, at least for Black women, we brush it off. And if it doesn't happen consistently, like every single day, and we're not feeling bad every single day, then we have a tendency just to hold that symptom to ourselves and talk about it maybe in a circle, but we talk about it jokingly and don't get whatever our issues are solved. So, how would you say that a woman who might have some of the symptoms actually come and talk to a doctor?
I think because of social media and because of the education today, I think more women are coming to the doctor feeling comfortable to ask the questions honestly. And I would say women of color as well as women that are not of color as well. So tr- so that's changing, okay? But we as physicians need to do a better job. So if I see a patient that is actually like in Kishi, who's like in her 40s, I need to be asking the question to her, even if she doesn't bring it up. That's part of the review of systems. In Kishi, are you noticing any changes in your menstrual cycle? Are you noticing, are you getting hot flashes? And then usually when you start that conversation, for the most part, patients will actually start to chime in on their symptoms. So we need to have that open dialogue to allow patients to be able to say, yeah, yeah, by the way, I am having that. And then it starts a conversation that hopefully women will feel comfortable with their provider, behind closed doors to really start talking about. I noticed that I'm gaining a lot of weight and I'm craving carbohydrates. For some reason, I'm eating a lot more sugar than I ever had. And oh, by the way, I don't feel like exercising as much anymore because I'm so darn tired. And so again, that conversation, it needs to be addressed actually with the physician asking the questions. If the patient is not voluntarily going to say, oh, by the way, I want to tell you about X, Y, and Z, we need to be bringing up the conversation because just like we talk about contraception and we talk about, pregnancy and all of that, we need to talk about perimenopause and menopause. So the conversation in the sense of asking the questions need to be asked by the physician when you actually come in, and that you feel comfortable being able to have that conversation if the doctor is actually raising the questions actually for you. The other thing too is that we have to do a better job. I'm in academic medicine, and I would just say this that we, as providers that teach our future generation of physicians, also need to do a better job in teaching our residents who are the future doctors about menopause. Many of them don't even understand it. I mean, they understand it, they know what it is, but to have a conversation with an older patient who says, I'm feeling miserable, blah, 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 and to be able to start the conversation about how can I help you with whether it's hormones or other drugs, that kind of stuff, we need to start that conversation. You have to understand when an OBGYN actually finishes residency, if they go straight through, they're really like early 30, okay? They too haven't even and particularly since the majority of OBGYNs today are females. The men are a dying generation in the sense of our field, but you actually relate to your patients as you go through your own journey. And so you have a 30-year-old talking to a 50-year-old or a 47-year-old as you went through it and don't really know what to say because they're talking about contraception, when are you going to start your family planning, blah 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 blah, and they're not even thinking about the woman who's done with all of that and wants to talk about, I feel miserable in this stage of my life and how can you help me? And rather than just say this is normal, you need to come up with like solutions to help that patient as well. So we need to do a better job in the sense of teaching the generation of doctors that come well after me about being comfortable, whether you're 30, 40, 50, whether you lived it or not lived it, to have those conversations with women of all different ages that are going to be a part of your practice and have your patients feel comfortable being able to have those conversations with you as a provider also.
And Kishi, did you have something to say? And say with regard to what Dr.
Yeah,
Bowles Johnson said?
I did. So thank you so much for bringing that up. The first time that it was suggested to me that I was in perimenopause, of course, I'm like, no, I'm too young, you know. But I was maybe 40 years old, and I just, like I said, I brushed it off. I thought it was my thyroid was acting up or whatever. And so at the time, and no shade, but I had a male OBGYN, and I had a male primary care physician. So I thought, I'm gaining weight, like I can't keep the weight off, like, and I said to my provider, I said, could it possibly, be in premenopause? Because I didn't know the word peri even. I'm just hearing that for the first time in the past couple of years. I just said, could I be premenopause? And he said, no, you're too young. He said, it's just your thyroid, So I did ask, and I was dismissed. And again, no shade to the men. I'm sure there are a host of wonderful male physicians, but that experience after, 4 or 5 years later, being told I'm at dust, I'm like, had I gotten information earlier, sooner, to understand what was happening to me, so many other things in my life would have been different. How I handled myself, how I interacted with my children. If I understood that menopause was more than just hot flashes and no period, I would have done, I think, in retrospect, so many things differently in terms of measuring, work and just work life balance. All of these things I would have done differently with information. But when I asked, I was shot down. And so I think that what you said is so important, that once women start reaching a certain age, please, physicians, be more proactive, talk to us, and don't assume just because we're young that we can't be in that stage. And I think that's so critical.
In my role as a certified nutrition specialist candidate, one of the things that I let my clients know first, I don't diagnose or treat in the way that doctors can. But one of the things I can do is help my clients to track, because we know that once they get to their doctor, they're limited on the amount of time that they're going to have with their doctor. So I always want to let people know that it is important for you to track your symptoms when they started. And there's a really important tool that I like to share. It's from the National Menopause Foundation. They have a document that you can use. It's a PDF where you can put your age of onset and the symptoms you're experiencing. And every couple of months, I recommend that they redo that so you can see how your symptoms are changing and take that with you to your doctor to say, 2 months ago, I was experiencing these 4 symptoms. Now I'm experiencing these 7 symptoms, because now we know that there are more like 34, 35 symptoms that are being experienced rather than the 4 or 5 that we typically ask about. So it's really important that we are tracking and recognizing that there are more symptoms that can be experienced.
Mhm. Mhm.
Absolutely. And Ashley, you brought quite a few tools to the Forward Women's Leadership Forum that allow us to track and explore and explain and the research. And I want to make sure, one of my goals is to make sure that that gets up on our website with reference.
Yeah.
Mhm.
um, I do want to, we've spoken a while, and I want to make sure that we get all that we can get in, and maybe this is uh, part one of part two. But I want to turn to Ashley and ask her to round up for us, and I'm asking her to round up in a positive way, which is to tell us and the audience that one food that we can just swap out, that with ease now, Ashley, with ease, that we can swap out this week, that can perhaps help us.
Okay, so it's going to look more like a category depending on what people are selecting, but oftentimes what I'm seeing is a lot of my clients are experiencing like a crash in their blood sugar, and they're experiencing the symptoms related to that. One of the things I like to recommend is incorporating more protein into your diet. A lot of us are choosing very carb heavy breakfasts. So that can look like chia seed puddings. If you're doing a smoothie, you can add protein powders to it. Make sure that you're incorporating greens into that as well. So it's not just a fruit based smoothie. And the other thing that I really like to make sure that people are aware of is making sure that they're getting enough magnesium in their diet. Most of us do not get enough magnesium, and we don't even realize how important it is. Magnesium is involved in over 300 reactions within our body, and that could, you know, completely change the way that we are experiencing menopause. So that could look like pumpkin seeds, are different nuts and seeds that you can incorporate depending on what your preference is. It could look like incorporating bananas, different foods, and our dark leafy greens. So whatever your preference is, just making sure that you are getting enough of the magnesium in your diet can change how you're experiencing your digestion, how you are experiencing muscle cramps, brain fog. All of those can be a result of the role that magnesium plays. And now it's not just magnesium alone, but magnesium is definitely playing an extremely important supportive role there. So, in whatever form your preference wants to receive it,
Okay.
we want to make sure that you are getting magnesium in your diet.
Magnesium seems to be the word. Maybe it's magnesium may uh, that
Mhm.
we need to experience. So I want to thank you all for being the guests, and you were a perfect guest on this podcast. And I'm hoping to do more going forward, right? Going forward, to use that term. This is the Forward Forum podcast, and we want women out there to know that they're not broken, they're never too much, and they're not alone. And that in having conversation, if you're not having conversation in your circles, and you're not having conversation in with your families, let me tell you, have conversation with us. Have conversation with us and learn from us, because what we want to do is bring you the truth and real talk among women who have had experience. We bring experts to this table. Again, thank you to the incredible guest here, Dr. Bowles Johnson, Ashley Brooks, and Nkishi Free. I appreciate your time given to us today and your honesty. I want you all to continue to follow us on Instagram, YouTube, LinkedIn, and we will see you in the next podcast, where we may talk more about menopause if that is the demand, or we will talk about finances, which is a pillar of the forum, careers, and or entrepreneurship. So I hope that you will follow us and be with us soon. Thank you and have a good day.
Thank you.
Thank you.
Thank you.